Here we can start. My superstar.
Bill, I like this.
We thank you. I will call the Senate Regulated Industries and Utilities Committee meeting to order. We left off yesterday on House Bill 571 and ex-Senator Hawkins, Chairman Hawkins, come back to us. You gave us the brief overview
Yes.
yesterday. I wanted to at least do that, but we did not take testimony. We have three people lined up to speak. And so
Okay.
if you have anything you'd like to add, please do so now and we'll go ahead and take the testimony and see if we can work through this fairly quickly.
You know, I did go through it pretty quick, and I guess how we got here is important. And I did not go over that. A few years ago, a friend of mine, a radiologist in Gainesville, Georgia, Lee Martin, he and I are the same age and known each other growing up. And he was lamenting to me about how many people have moved into Northeast Georgia, just a plethora. And a lot of them are people with gray hair. And those people tend to require quite a bit of health care that also involves radiology. So his workload has just went skyrocketed. And he was looking at a model that has begun in Georgia, but especially in North Carolina, they have schools for radiology assistants. We don't have one in Georgia. We have radiology techs, which is a 2-year study, and then additional 2 years to be a radiology assistant. So we were looking at that, setting up the goals of having radiology, more radiology assistants in Georgia. We have some now, but also it came about working with the board because these were not licensed. These people were not licensed in the state of Georgia. And in the state where you require a little girl to sell lemonade, a license in the city of Atlanta, you definitely want your healthcare personnel licensed. So that became work with the board, led to work with the Board of Medicine. So that's how the bill's changed a little bit the last 2 years for what you saw. We had this bill last year, 434, that passed through this committee and was unfortunately left on the table. So that's the brief beginning of this. And
What
that's
does
all
a
I can say.
radiology assistant do?
Well, they actually assist the radiologist by allowing the radiologist to be in the room reading scans and things like that. And so the assistants downstairs doing the things that you don't want to have done to you, like the barium swallows and the barium up the other way, enemas. They can do venous access, in other words, put in a line, an IV line, do fluoroscopic studies, things like that nature. What the future looks like is them doing more procedures that are a little more invasive, but you have the radiologist on site. And that's what the board has put into this. You've got general supervision, which are the things I've mentioned that they can do without the radiologist being in the hospital, and then more advanced procedures with the radiologist being in the hospital. IVPs and things like that, injecting dyes, you can do that actually without a radiologist being in the hospital because you have physicians that can treat a patient that would have an anaphylactic reaction, an allergy, to the medicine. So that can be taken care of by other physicians. But when you're placing a needle in certain areas of the body and in lungs and trying to put a PICC line in, you need to have a radiologist around there. So if the assistant's having a problem, they have someone to take over and accomplish the task for the patient.
Okay. Anybody have questions for Representative Hawkins at this time? Senator Dolezal, you're recognized for a question.
Thank you, Mr. Chairman. Thank you for being here, Chairman. Thank you for bringing the bill. Can you clarify for me on line 67 of the bill? This references the board should be authorized to require persons seeking renewal of licensure to practice as a radiologist assistant under Article 13. Do radiologist assistants already exist, and are they already licensed?
We have them in the state of Georgia, but they're not licensed in the state of Georgia. If you look on page 5, Article 13, that is the licensure language that would go into code to license them.
I got it. My only other question was on the on line 109, that the board may issue a license if the person completes all the requirements. And I'm wondering why the board wouldn't be compelled to issue the license. I'm just wondering why that may is not a shall if they do complete all of the requirements. What would be a scenario where the board would not issue it?
You know, I think what they're referring to here is a person shall be qualified for licensure, shall be qualified, but the board may issue a license. In other words, there may be other issues involved with that assistant. Maybe some questionable moral issues or whatever that may come up. So in other words, the person is qualified by taking courses, but the board still is responsible for protecting the public. So there may be some other issues. So I assume the lawyers put may in there rather than shall
Okay,
to
thank you.
cover that issue.
Senator Kennedy, you're recognized for a question.
Thank you, Mr. Chairman. Morning, Chairman Hawkins.
Good
Good to
morning.
see you. Thank you. I'm sorry I was not able to attend yesterday. I was presenting a bill somewhere else, so I may have missed what you said. So if some of this is duplicative, forgive me. But you mentioned, thank you, a moment ago that there was general supervision
Right.
for assistants now. Are there different levels of supervision now for radiology assistants?
Not actually, because they're not in code. What radiology's been operating under is really a standard that protects the patient and what is best for the patient. So the assistants are doing what would be called general supervision things, non-invasive, venous access and IV line. In most instances, you would not consider invasive, okay? You put a needle in a lung, you put a needle in another organ that's being guided radiologically, that's invasive. So that's the distinction between the two.
Okay.
And you know, in the future, some of those things may be applicable, but first you got to get somebody licensed. First, you got to establish, you know, what they are doing and what, you move forward. Just like in law and medicine and healthcare and dentistry, we move forward from where we are. And that's what this bill is actually doing.
And who determines what level of supervision that a radiologist assistant is able to perform procedures?
Well, after this bill is passed, if it is passed, it will be the Board of Medicine. And also CMS has established levels already. So those would be the two guidance areas for this.
Mr. Chairman, a couple.
Go right ahead.
Do you think that defining an RA as under the on-site direct supervision would limit the ability of a radiologist assistant to perform duties that they can already perform?
Well, you know, that's what has come into question. I think the perception of what is a safe, allowable procedure for an RA to do is part of the discussion now. And the Board of Medicine has weighed in. I went to their meeting in December, wish you could have gone with me. They've weighed in and appropriately so. They are there to protect the health of the public and to define the roles of all healthcare providers. And that's what this bill is doing. It's defining the role, not to say, if you look in the bill, and especially in the amendments you have in your package, it speaks to the future. And that is, you know, procedures that will be defined in the future. We don't want to put every procedure in the bill, because if we lock it in, then when a new procedure comes up, we've got to do, a new code section. So,
Sure.
Yeah.
And I take it that under the model you're proposing going forward, where RAs would be licensed, then if we define the scope of what RAs can do,
Right.
if they are found to be operating outside of that, then there would be a mechanism to pull or suspend the license if they're operating beyond what the Composite Board of Medical Examiners prescribes.
Yes.
Does that sound right? Okay,
Yes.
thank you. Last thing I'll say is I know you've worked with my office on some proposed modifications and an amendment, and thank you for that, trying
You're
to
welcome.
address some concerns of our constituents. I appreciate your cooperation on that.
Thank you. Appreciate your help.
Yes, sir.
In that reference, you will see in your folders a proposed amendment that Senator Kennedy brought to me yesterday or the day before that may be considered later. And I think you've got a copy of that as well, Representative Hawkins. Is that what you had discussed with Senator Kennedy's office?
Yeah.
Okay.
I think it's a very sensible amendment. I have no problem with friendly amendment.
Okay.
Thank you.
Senator Brass, you are recognized for a question.
Thank you, Mr. Chairman. Thank you, Chairman Hawkins, for bringing this. Question for you though. So the House, we've had lots of bills coming over out of this blue ribbon commission or whatever it was y'all did that was kind of unwinding
Right,
a lot of licensure requirements
right.
and we've been doing some red tape rollback and a lot of it centered around unwinding a lot of licensure stuff we've done through the state through the years.
Mhm.
Does this fit into that mindset that we're trying to not to put too many restraints on these people that are qualified? I'm just trying to figure out, are we putting more unburdened requests or requirements on these people or not? And if you could just kind of help walk me through that,
Sure,
that would be
yeah,
great.
No, that's a reasonable question. We're talking about a group of people that are not licensed in the state of Georgia and doing healthcare treatment on patients. That is a problem within itself. So this is a bill that license those and then sets up the procedures that they can do. And then with the two amendments we have, sets up what the future could be for them. And that's actually where we started with the bill 2 years ago, was looking for a way to assist the radiologists, since we're not producing more and Georgia's growing in leaps and bounds. If we don't do anything, then you or your family may well wait 3 or 4 days to have a procedure done that you need because you're waiting for the results of the radiology test. And we don't want that. So we want to utilize mid-level providers who are trained, 2 years for a tech, an additional 2 years for an assistant, who are trained to do procedures safely, reliably, and provide that information to the radiologist. These folks they're doing diagnostic tests, but they're not making a diagnosis. That is the physician making the diagnosis.
Go ahead.
Follow up, Mr. Chairman. So I guess one of my concerns is looking forward, once we set up a licensure, is then we start controlling their scope of practice and all that. And I want to make sure that we're going to allow them the full scope of their practice, because we have seen in other mid-level providers,
Right.
quote unquote, we've seen where they're granted a full scope of practice, but yet they're limited by the law.
Right,
And so I just want to make sure that that's not happening.
right. That's where we started. I mean, that was the target of the beginning of this. And I agree with you, but somewhere you have a beginning and then you have a future. This is only the beginning.
Gotcha. Thank you.
Senator Summers, you're recognized for a question.
Thank you, Chairman Hawkins. Thank you, Mr. Chairman. I'm a little, walk me through one thing, make me understand this. You're trying to say they got to be licensed by July the 1st, 2025.
Mhm.
Now, I'm assuming the governor signs this bill real quickly.
Right.
And I'm assuming that happens and you got about 3 months to get licenses.
Right.
Are
The
we,
ones that are here now, yes.
okay, the ones you're here now. Is that a time burden that would cause an issue? Because it seems like to me, you're putting a constraint on the issue that may or may not be able to work it out.
I had that same question and I was sure that this could be done within 3 months. I think the awareness is out there that this is happening with the radiology assistants. I think and with radiologists, my radiologist at home, he's very excited to see this occur. I mean, he's looking toward the future. So everybody's on deck and they know this is going on. So 3 months is not an impossible target date to be registered, licensed.
Mr. Chairman?
Yeah, go ahead, follow up.
The composite board or whoever gives them this license,
Mhm.
could you kind of walk through that? Are they?
They're going to set up their own advisory board. That's in,
Right, that's all
I'd have
right.
to look back, the section,
Right, I'm asking about the board,
it's in the bill.
but it's not there, so that board's not there yet.
No.
That's what I was getting, is all that in the same time frame and the 25th,
Oh, yeah. yeah.
to-
This was in guidance and advice of the Board of Medicine. This is the part that they wanted in there. So you're talking about line 205,
Yeah.
section 337.
Are you comfortable with that? Then? I mean, you're comfortable with July the first?
You know, I trust the board.
I
They
just don't want to
say-
hurt anybody that's trying to get there.
Yeah, no, I trust the advice. I think I had the same question, and I've been assured that that's not going to be a problem. We had that discussion.
Thank you, Mr. Chairman.
All right, other questions? Okay, we'll hear a little testimony then, trying to move our agenda along. Becky Riles,
You need to get up or
you just stay right there and she'll go to the podium. Yeah.
Morning, Chairman Cowser, members of the committee. Thank you for the opportunity to speak to you today. I'm Becky Riles, representing the Georgia Radiological Society and the Georgia Society for Radiologic Technologists. I'd like to just make a few comments in response to some of the questions, if I may. And then I would also like to introduce Dr. Bill Harrington, who is here to speak as well. So in reference to the historical context, radiologist assistants came to Georgia in the early 2000s. And in 2009, they came to us and said, we would like to be recognized in Georgia law as a healthcare provider. So they were a very new entity. They were a very new healthcare provider. They were just coming out of their training programs. And so we put that, we were able to get legislation passed, thanks to you all, that recognized them as a healthcare provider. So fast forward 15 years, and as more radiologist assistants look to come to Georgia, the nearest school, as Chairman Hawkins mentioned, is North Carolina. And many of those, when they complete their training, they look to Georgia. There are imaging groups, there are hospitals who would like to hire radiologist assistants, but they're reluctant to do so without licensure. So we feel that this addresses the healthcare workforce issue. It certainly will address the access for patients to get the diagnostic studies that they need in a more timely fashion, and most importantly, that they get the results in a more timely fashion so that they can move on to whatever their treatment plan is appropriate for their diagnosis. In response to the question about the licensure from the board, in discussion with the board, they felt that RAs should be licensed rather than trying to promulgate additional rules and regs. They looked at the training of an RA, so they are rad tech, then they go back for 2 years additional training, as well as clinical training to make sure that they are competent in the procedures that they're going to perform. And then they go to work as a radiologist assistant. The Composite Medical Board felt that their training was commensurate with other mid-levels in Georgia that the Composite Board licenses, and then they approve a protocol agreement. And that protocol agreement will contain the procedures that that particular radiologist assistant is trained and competent to perform. And that will also depend on the radiologists that they're working for. So radiology, there are a variety of specialties. There are musculoskeletal, there are neuroradiologists, there are interventional radiologists. So their training and their competency and procedures will match the radiologists that they're working for. So I hope that that helps to know that the protocol agreement will be the same methodology that's followed with other mid-level providers.
So
And then-
today, before you go further, we have radiologist assistants, right? They're used in the medical profession and they're defined in the code what they do, but they are not licensed.
Correct. They are defined in the code as a healthcare provider in Georgia.
Okay.
And when we approached the board to suggest that it's time, 15 years later, to further expand on that and to promulgate additional rules and regs, then they put together a working group, and it included a radiologist who serves on the Composite Medical Board. And in their discernment and discussion, they determined that because their level of training and what they are doing as a healthcare provider is comparable to other mid-levels, they wanted to provide licensure for these mid-levels.
Can the current radiologist assistant charge for their services, or are they just encompassed in the radiologist bill?
They are encompassed in the radiologist bill. They do not bill directly.
Will this allow them to?
This bill will not, but as Chairman Hawkins said, it's a starting point and licensure is the first step. CMS recognizes radiologist assistants according to levels of supervision, but the pay for is not yet set up at the federal level.
Okay. And that's why you repealed at lines 84 and 85, the current definition of a radiologist assistant. And you create a new one here on lines 98 to 107 that says what these licensed radiologist assistants will be permitted to do.
That's correct.
Okay. And they can't do diagnosis and they can't prescribe and they can't read x-rays or other
They can't interpret.
studies.
Yes.
Okay.
Yeah.
So they're just helping the radiologist do his job.
Yes. And one example is there are several procedures that take a bit of time to get the patient prepared. And so the radiologist assistant can make sure that the patient has been compliant in getting ready for the procedure. If they are going to biopsy an organ, for example, the radiologist assistant can measure the organ, make sure that everything is in order. And while this is occurring, the radiologist can be in the reading room interpreting studies to get those back to patients and other providers. So in some cases where there may be more invasive studies, the RA can assist the patient in getting prepared for the procedure. The radiologist can come in and then perform the procedure. And the levels of supervision as defined by CMS are personal, direct, and general. Personal is the radiologist is in the room. Direct is they are in the building, they are available. And general is the radiologist is not on site, but they are supervising and they are available, say via teleconference, but they don't have to be on the premises.
Are you through with your presentation?
Yes, sir.
All right, Senator Dolezal, you're recognized for a question.
Thank you. This was actually the first question I was trying to get clarity on. And you said something that I guess got my attention. I think I misunderstood this. So currently these radiologist assistants are recognized in code. Do they have to be, as we're calling now for the licensure, do they have to be registered and credentialed as a radiographer with the American Registry of Radiologic Technologists?
Yes.
So they already have to have all of the training that they would have to have under this bill. Is this ultimately a path? What's the impetus for this? Is this the impetus, the ultimate destination of separate billing?
So it's really more, the impetus is more of a career path for a rad tech. So once you go through the training to become a radiologic technologist and you are doing that work, that's really the extent of your career path. And so this radiologist assistant can go back, you go back to school for additional training. So it's a career path for them to advance what they are doing in imaging procedures.
Okay, I'm a little more confused. Will this require them to get training above and beyond what
No,
they're required?
No, sir. I'm sorry. I didn't understand your question. Yes.
So help me understand how being licensed versus being registered and credentialed creates a career path.
The career path is when you become an RA, it's a step above being a rad tech. So you're becoming a mid-level provider as a radiologist assistant, as a rad tech. That is pretty much as far as you can go in that path. And that's something that we've seen in imaging centers and hospitals, is that some rad techs are leaving the field to go into administration because there is not that career path. So this allows them, for those who choose to, yes, it is an option for those rad techs who would like to move on to a mid-level position to become an RA.
Okay, thank you.
So why can't they just call themselves an RA now? This makes an impediment. They now have to go get licensed to do something that right now they can do without a license.
So they've gone through the training. as a radiologist assistant. But there are some facilities and some imaging centers who are reluctant to hire them without licensure. And because they are doing the same level of work as other mid-level providers, the board felt that it was comparable to other mid-levels who are licensed, and found it appropriate that they be licensed.
Other questions? Ms. Ross, all right. Chairman Brass.
Thank you, Mr. Chairman. Becky, question for you. How many assistants, radiologist assistants do you anticipate having on July 1 of 2025?
Thank you for that question, Chairman Brass. I started to answer that and then I got distracted. So currently in Georgia, there are far less than 100 radiologist assistants. And so that's why the board and the staff felt comfortable with licensing that number by July. We hope that this licensure will create an incentive for more RAs to come to Georgia to assist radiology groups and hospitals around our state.
Well, so there's only 100 current RAs, but is there more that are RTs that are qualified?
The RTs would need to go back for their 2-year additional training to become an RA.
Okay.
So the less than 100 that I'm referring to, those are the rad techs who've gone to that additional 2-year training to become an RA.
Okay. I mean, I am a little concerned about the date that Chairman Summers pointed out, that to form a board and then go through 100 applications in a matter of, I mean, you're probably talking 2 months. And as we say around here, the wheels of justice do not turn quickly. I do find that's a little concerning to me, that you're going to have, and then you get into, if you can't form all that, and then where are they can't practice their scope of practice as we've written in the law. You might have 100 that can't, you might have 90 that can't. You know, if that board doesn't form until August and get all their act together, that is a little concerning for me, especially for these 100 RAs out there.
As I understand the legislation, it would not prohibit anyone to continue doing what they're doing now. It's just that they would go through the licensure path. And keep in mind that this advisory group is an advisory group that is formed under the Composite Medical Board.
Okay.
So currently they have a PA advisory group, they have genetic counselor advisory groups, et cetera.
Well, quick follow-up, Mr. Chairman.
Sure,
It
go right
says on
ahead.
line 167, on and after July 1, 2025, a person shall not engage in the scope of practice for radiologist assistants in the state without a valid license issued by the board pursuant to this article. So those 100 people are relying on this board to get formed and approve their licenses by July 1, or they cannot practice. That is what this says. So that's my concern for those 100 people.
All right. Other questions? All right, Dr. Bill Harrington. Doc, introduce yourself, tell them your career and current
Sure.
positions or post positions.
Yeah, I'm Bill Harrington. I'm from Athens, Georgia, recently retired radiology there after 39 years of practice in Athens. I graduated the University of Georgia in 1976, Medical College of Georgia in 1979. No, medical school was not 3 years long. It was 4, but I got accepted in my junior year and got credit for my freshman year of medical school. Went off to the military, trained at Bethesda Naval Hospital in radiology, served time with the Marine Corps in between, and came back to Athens once I finished my military obligated service at Portsmouth Naval Hospital in Portsmouth, Virginia, and have been in Athens ever since. For a radiologist to stay in a practice that they initially go to for all those years is a pretty rare event. They tend to move around. During that time, I served on the Georgia Radiology Society board. eventually becoming the president of the Georgia Radiology Society, and then within the American College of Radiology, which represents 38,000 radiologists, radiation oncologists, nuclear medicine physicians, and radiation physicists nationwide. I was a counselor. A counselor would be like being a senator. It's our legislative branch, passes policy matters by resolution. I was there when the initial agreement between the ASRT, the ARRT, and the ACR. So ARRT is a licensing. Think of that as like a medical, as a board, AOB, as the boards, the national boards that all physicians get certified by. This is for radiologists. The ASRT is a Society of Radiation Technologists. That's like the ACR. It's a professional society. We came to an agreement as to what we wanted to create. The reasons that I think have been stated, radiologic technologists, if it's a career path that unless you go into administration, you've got no upward mobility after so many years. You may have been working as an RT in the angio lab for 10 years. What do you get to do next? Well, you get to be an administrator, but there's really no place up. So it was seen as an upward path for the radiologic technologists who wanted to give higher level care. It was also viewed as a workforce issue. We weren't challenged by the workforce so much in 2001, but we certainly become since. And so this has been in existence for some time. And in the ACR, I became the vice speaker and then speaker of the council. I know a lot of parliamentary procedure. Was on the board for 6 years and am the immediate past president of the American College of Radiology. I actually retired from active practice in June because that involved so much travel, both U.S. and international, that I couldn't work and do that as well. So I have a long history with this. I'd be glad to answer any questions. You have a letter from me fully supporting that this licensure for RTs, and I would encourage you to pass this. When someone asks why have licensure, hospitals you can be credentialed in a hospital, but you may not necessarily be privileged. People get that confused. Just because you have the credentials to do something doesn't mean you're allowed to do it. Hospitals grant privileges, and they may, for reasons, not allow someone who has training to do it in their hospital because for their workflow, the way their hospital operates, they're better off with one particular specialty versus another. Hospitals are reluctant to allow physicians to bring extenders who are not licensed individuals to give medical care in the state of Georgia. So there is a not hard wall, but pretty much a wall. Both hospitals in Athens require that you be board eligible or board certified to practice in your specialty.
So what if there is no specialty like a radiology assistant? Do they allow you to, will Athens hospitals allow these people to work today?
We have not hired an RA in Athens at either St. Mary's or Piedmont Athens Regional. We have PAs that work for us, and that is more established. I think it would be a test case if we said we hired an RA to go to the hospital and ask for them to get privileges to work in the hospital, because they would say, well, what's the licensure status here of this individual?
Does this bill allow for general supervision? I'm not so comfortable with that if it's off-site or
Yeah, I think
telephone.
so. CMS, actually, Medicare, defined the supervision level. So there's personal, you have to be in the room. There's direct, you have to be on site. That doesn't necessarily mean in the building per se. Like Emory's got a lot of buildings, so on the campus at least. And then there's general, you can be remote. No radiologist is anywhere physically close enough to be there in minutes, but you have to be available by telephone or teleconference.
Does this bill allow a radiologist assistant?
As it's currently
to be
written, the way I,
general supervision?
yeah, the way I read it, there are certain procedures in this bill that grant general. There are others that maintain direct and give the Composite Board of Medical Examiners the freedom to decide whether they want to move some of the direct supervision into the general in the future.
Okay. Senator Summers, you're recognized for a question.
Thank you, Mr. Chairman. Dr. Harrington,
Yes, sir.
walk me through this right here. Make me understand this. A radiologist assistant tech right now, right there, techs right now.
No, a radiologic technologist goes to technology school. We have one in Athens.
Okay, fair enough.
It's a
Okay.
2-year program out of high school.
Okay, so they get this license, and you say this license will allow them to move up. Is that a pay grade? Is that a better grade? Do they automatically get? Is that better for the hospitals? Better for the doctors? Better? I know it's better for the patients, obviously. But what I'm trying to say is, if we're just giving them a title and not helping them, I mean, where are we going with this?
Well, if you're a radiologic technologist, you've gone to 2 years of school. As I said, you've got no place to go, but maybe you're in charge of a section and you have to do the call schedules and that sort of stuff, and you may get paid more in grade for the number of years and the responsibilities you take on. You have to go back to school and get other clinical training that puts you on par with a PA or a nurse practitioner as equivalent of bachelor's or master's degree once you've done that. And now you're working more directly for the radiologist, doing things that only the physician can do, just like the PAs and nurse practitioners who assist physicians. So clearly that's going to involve more pay. And in 2021, CMS finally recognized and granted the same modifier code for RAs as PAs and nurse practitioners, which is 80% of what would be the billing if a physician was doing the procedure. So if I do a BE, I get paid a certain amount of money. If a physician assistant were to do that BE, I get paid 80%. The RA must work for a radiologist. Can't work for any other physician type. Number two, the physician does the billing. There is no separate billing for the radiologist assistant. And the House of Radiology would be dead set against independent billing, because I think a lot of physicians, as you probably heard in testimony over the years, are a little uncomfortable with the erosion of what physician services are and what physician extenders are now allowed to do on their own.
Follow up, please.
Yes,
If this person achieves this level of whatever accreditation, are they allowed to do what a PA is, like prescribing medicine or those type things, like a PA or NP?
No. There are specific guides in the ARRT, the exam that they take, the credentialing that they get that specifically accept interpretation, prescription of drugs, so on, so forth. So in the credentialing package for the AART, which the ACR has input on, specifically says what they can and can't do. So independent practice is not on the table.
Senator Brass.
Thank you, Mr. Chairman. Doc, do you, I get, there's some stats out there that, medical professionals tend to kind of stay located near where they train, or near, like, I know we've tried to beef up our residency programs specifically in rural areas in hopes that those doctors would stay on. With us not having a RA school here in this state, is there any concern that we're going to see an erosion within these mid-levels, that as they leave the state to go get trained, to this extra training to become a RA or radiologist assistant? Is there any concern that we're going to kind of lose some of that sector?
I think it's feasible. There are only 6 schools nationwide
Wow.
in existence. There were 20 at one time, but it took forever for us to lobby CMS. If you think things work slow here, try working
Right.
at the federal level.
I get it.
And
Been
so
there.
a lot of the schools were dying because there were no jobs. So I think this is a good place to live, Georgia.
Right.
I think we have been lucky in that it's very hard to recruit physicians, but in Athens, Georgia is a nice place to live. I was just up at the invitation of the Johns Hopkins residents there, and I met with their faculty. They can't hire faculty. They have plenty of faculty who say, we'll work Telerad, but we're not going to move to Baltimore. So yeah, it is getting to crunch. I think the reason physicians tend to stay where they trained is because they start families. at the same time they're training. If my wife didn't like Athens, I wouldn't be there, no matter how much I like it.
Right.
And so
I get it.
I think that's the crux. The reason you stay where you trained is you put down roots where you're training. Because in medical school, you're too busy to be fooling with that.
Okay. Thank you.
Senator Dolzall, you're recognized for a question.
Thank you, Chairman. Thank you, Doctor. Can you walk us through that 80% piece again? Because I'm wondering if.
Well,
I
that's
asked that question
Medicare.
of-
So Medicare.
Correct.
So the Medicare recognizes a payment level for physician services. If the physician reassigns that service to a qualified individual, which would be PA, nurse practitioner, and now in the case of RAs, they specifically have language saying as of 2023, RAs are in that category.
Can I pause you?
Yeah.
Certified RAs or licensed RAs?
I don't think they went into detail about license because licensure is a state issue.
So currently in Georgia, for the existing 100 or so people, can they trigger a Medicare billing?
Yes.
Okay.
Now, the problem is, okay, there's a issue here. We weren't going to get into, Becky says, let's start getting in the billing, but we've gotten in the billing. So here's the problem. In 2023, CMS said, okay, we're going to give the same code for the PAs and nurse practitioners. But oh, by the way, we need legislation that allows us to release the funds. So somehow or another, the fact that they get funds that they can disperse for medical care, they needed a special piece of legislation in order to pay RAs, because even though they gave them the same code that's used for PAs and nurse practitioners, they said we have to have legislation to be able to pay
Federal
them.
legislation or state?
Federal.
Okay.
We're just talking Medicare here. And so right now, we can't bill Medicare for reassignment of RA services anywhere in the nation. We're working to get that changed because it doesn't make sense. Why would you give us a code and then say you can't pay because you aren't authorized to actually release funds? It's kind of a smoke and mirrors deal.
Do you believe that when that's cleared up federally, that a license is going to be required for billing?
No, because the federal government does not license individuals in medical care. The states do.
So
They would at most require them to be credentialed, I would think.
Okay.
And so there's a confusion, and sometimes you'll see the term RA, that's a radiologist assistant. The term RRA is registered radiologist assistant. That just means they passed their registry. They are credentialed.
I think the confusion, Doctor, maybe you can help us
Yeah.
with this. You're hearing a lot of questions on this.
Yeah.
And go back to what Chairman Brass mentioned earlier. We've been in this posture of less licensure, less regulation, less barriers to entry for employment. We have these people who are working today. They've already been certified. They already have their education. Seemingly it's working. What is the problem that we're trying to solve? I think that's maybe what, at least speaking for myself, what I'm confused about, and maybe other members of the committee are as well. Can you help us clarify that?
Well, I think, like I said, I think I would have a hard time convincing the board at St. Mary's or Piedmont Athens Regional to allow me to have an RA who has no licensure status in the state of Georgia. So the barrier is employment in hospitals that set a reasonably high bar for who can be giving medical care in their hospital.
And you believe that in lieu of licensure, in other words, there is no state licensure, but these people have been certified. The mere presence of the license with the same education, the same training, et cetera, will move them to the point of being more employable within hospitals as opposed to hospitals just changing their policy.
Yeah, absolutely.
Okay.
Hospitals change their policy about as infrequently as the federal
Sure.
do.
Sure. Okay. That's helpful. Thank you.
All right, thank you. Appreciate you, Dr. Harrington. Thanks for being
thank
here
you.
and admitting publicly that your wife wears the pants in your family.
I wear them. She tells me what color to put on.
Dr. Ali, I can't pronounce your last name, Sheikh. Good to have you with us, and if you'll just take the podium there, share your thoughts on House Bill
Great.
571.
Thank you, Mr. Chairman and esteemed members of the committee for giving me the opportunity to present my point of view on House Bill 571. Let me start by introducing myself. I'm Dr. Ali Sheikh. I've been practicing radiologist in Houston County for the last 20 years. I am the medical director for the radiology departments at Houston Medical Center in Warner Robins, Georgia, Coffee Regional Medical Center in Douglas, Georgia, at Spalding Regional in Griffin, Georgia. House Bill 571 is being proposed to make radiology assistants and radiology practitioner assistants a licensed entity to be governed by the medical board. This entity of mid-level providers has been operating in Georgia under Georgia Code Title 43, Chapter 34 since 2009 as an unlicensed entity without any safety issues. And we have a radiology assistant in our practice currently since 2019. I'm not opposed to the idea of streamlining the licensure process for the radiology assistants. However, the bill in its current form is very restrictive and will be detrimental to the citizens of Houston County and the surrounding counties that we service. It will restrict patient access to simple, important, many a times life-saving procedures by stopping the radiology assistant to provide services under general supervision, especially after hours. The bill in its current form only allows radiology assistants to perform these procedures under direct supervision, meaning the supervision person has to be on site. We all know there's a severe national shortage of interventional radiologists and radiologists. For example, in Houston County, we're only 2 interventional radiologists that are on call every other night. We absolutely need radiology assistants to continue to perform these critical but simple procedures under general supervision in our department, which show up at all odd hours of the day. Making patients wait for these procedures would have an adverse outcome on their healthcare. To give the committee a perspective of the national shortage of radiologists and interventional radiologists, there are only 190 programs in the country, 190 slots per year in the country that train interventional radiologists. A recent study in the Journal of Health Imaging says that out of there are 3,142 counties in the country. Only 347 counties in the United States have practicing interventional radiologists. If you think 300 out of 3,000, that is pretty remarkable that a lot of people don't have access to standard minimally invasive procedures. My concern is how do we continue to service the citizens of Houston County and the surrounding counties with the current restrictive language in the bill? My proposal is to insert general supervision everywhere where direct supervision is listed, giving clear language to the medical board of Georgia rather than leaving it to their interpretation. This proposed language would bring the bill at par to similar entities such as nurse practitioners and physician assistants. If someone wants to apply for general supervision, they can submit their case logs, demonstrate their proficiency by submitting their case logs as a part of the process. So that's my recommendation 1. Recommendation 2, the date in the license, which was just discussed, will change the date to Jan 1, 2026. It is not enough time to process these providers. Just to give you an example, Georgia Medical Board to license a physician is currently taking 3 months to 6 months to give a license to a physician. We've hired a nurse practitioner 3 years ago, and to do the nursing protocol, we still have not received approval from the Georgia Medical Board. We had to let that person go. And with regards to some of your questions, with regards to patient safety, for doing patients under general supervision, our RA has been working with us since 2019. He has done over 2,500 invasive procedures. These are minor invasive procedures, but he's done them without any safety concerns.
Is he doing those under general supervision now?
Yes, sir.
So you or the other guy that alternate days can just be sitting at home, call him, say, fire away?
Yeah,
Okay.
so we are available. We're within 30 minutes based on the bylaws of our hospital. So we are available. If he gets stuck, we're going to go in and fix it. But a lot of these procedures are very basic and very simple.
Give
So
me some examples though. I'm feeling squeamish just hearing this. If this was me being the patient, I want you in the building.
I know, but
in
there are
case
not
something
enough of
goes
us.
wrong.
There are not enough of us. So we are taking call every other day. We are burnt out.
So tell me about these invasive, minimally invasive or non-invasive procedures. What are you
Sure.
talking about?
So the non-invasive is not a concern. Non-invasive is you take some barium, you take some pictures.
Got it.
That's a non-invasive procedure.
Like
the-
take x-rays or the pictures you're talking about?
Correct.
Okay.
That's non-invasive. Invasive is putting in a small needle under image guidance, under ultrasound guidance, under x-ray guidance, and taking some, say, for example, fluid out. So I'll give you an example. The two big ones or three big ones. Patient who's got liver failure, they accumulate a lot of fluid in their belly. They come in because they're blown up. They can't breathe. They come in at 12 o'clock at night. All you have to do is put in a very small needle under ultrasound and suck that fluid out. Now, he's been doing that.
If y'all got an emergency room down there,
Yes, sir.
wouldn't there be a doc there that could do that?
So a lot of the doctors, this has fallen to radiology because a lot of the doctors in the ER don't have the skills to do them or don't want to do them. Neurologists, I'll give you an example. Neurologists, lumbar puncture, sticking a needle into the spine and taking some fluid out was part of their normal physical exam. I have yet to come across a neurologist in the last 10 years or 15 years that does that. They consult us.
You let an RA do that?
Yes,
Under
sir.
General supervision,
Yes, sir.
puncture your spine and take fluid out.
We do.
Okay.
Another example, you have fluid accumulate in your lungs. You have difficulty breathing. You put in a small needle. Again, the needle is thinner than the tip of this pen. It's a small needle under ultrasound guidance, and it is taken care of. I'll give you an example. My mother had to wait 3 days, and not at my hospital, another hospital, because geographically she was in a different location. 3 days to get her fluid pulled out in a hospital, which we do within 2 to 3 hours. So if a person is properly trained, a physician goes through training. It's a learned skill. We learn it. Same way an RA learns the skill, and he does it under our general direct personal supervision. So you start from personal, you move up to direct, you move up to general.
This
It's-
bill allow general, or you're wanting to change it so it does allow general? That's your complaint with the bill.
Right. I'm wanting to change it to allow general,
I
because why else would I hire a PA or an RA if I'm not able to use him properly? If I have to go in for every procedure myself, which I can't practically because there's not enough of me to go. So why would I hire an RA to do it under direct or personal if I can't use him to facilitate?
Other than the effective date and this general versus direct supervision issue, do you have other problems with the bill, the whole concept of licensing RAs?
My only concern is with the Medical Georgia Board, that once it does go there, I would like to make sure that somebody like me has oversight on this thing, because it might become very nebulous at that stage.
Okay. Other committee members have questions? All right, thank you for taking the time to come. Senator Brass has a question.
Thank you, sir.
No, sir, I've got a question for you, if you don't mind.
Yeah, go ahead, please.
So you've kind of highlighted something I've been discussing for years up here and walk us through or highlight more again, if you would. There's a difference in healthcare in metro areas versus rural areas, as far as availability of providers, availability of doctors. Walk me through why you think. Sorry, I'm kind of thinking out loud here, but it's if you could help us understand better why it's so different. Like what, because when we pass this law, it's statewide. And that's where we have a problem is, and I think, in my opinion, this is my opinion, your mid-level providers are have to be the answer in rural Georgia, and this is a perfect example of it. I do believe, because doctors can't be everywhere, and they're not going to be everywhere. So could you help me and the committee understand the sole difference in your rural setting versus a setting like Athens, where plenty of doctors, plenty of people, I mean, Athens, great place to live. I lived there for 5 years as a child and 5 years as a young adult. Love it. I'd go back too if my wife would allow me. But doesn't seem to be a shortage of doctors there. And so can you help us understand that difference a little bit better?
Rural areas, rural Georgia, rural US, everywhere is a problem to recruit physicians. It's people would like to stay in a bigger city. They have better education, better amenities, better things to do, extracurricular stuff. So there's always that attraction. The radiologist shortage was for us, it's been there since 2000. When even though there was a saturation of radiologists in Atlanta and Atlanta metro, larger metro area. So we've been dealing with this for a long time. But why would an RA be required in Atlanta and Atlanta metro areas? Right now, there's a shortage even in Atlanta. There are people that don't have access to care in a lot of places. What has happened is during COVID, after COVID, a fundamental change took place. A lot of people retired, and a lot of people got used to reading from home or doing tele. So the proceduralists were the only ones that remain in the hospital. I'm talking very generally. And a lot of those proceduralists are now shifting towards diagnostic and tele. So there's a shortage happening on that side. So a lot of people in my profession, interventional radiologists, are hanging up their skills and they're saying, I'm going to go sit and read because there's a lot more risk for me to take in the hospital than I can do while I'm reading.
Okay.
So we are facing an acute shortage of interventional radiologists. We're not training enough to start with. And this problem has been happening since it goes back to 2000 when Medicare funding got cut. So we didn't produce enough. So it's a combination of factors that has led us to this point. So I agree. We do need mid-levels. We do need them properly trained. I agree with that. But once we do the training, we don't want to restrict them by doing this. Now, the discussion about billing came up. We eat the cost for our RA to go do these procedures, but we want to continue the service. We want to keep providing that service. So that is where we are.
Thank you.
So aren't you worried that you ultimately lose your job if we go to this model? South Georgia is going to be served by a bunch of RAs doing procedures, and the doctors are going to be sitting watching them on TV in Atlanta. These big healthcare systems are just going to put RAs out there. It's almost dumbing down the medical care to the people in rural Georgia where they don't get real doctors. They get people that didn't even go to med school sticking needles in their spine.
So the idea is to have a radiologist as a supervising physician. You don't
But the
allow
supervision's
independent.
by television. or,
No, right.
By Zoom or a phone call. Doesn't say they got to be within 30 minutes like you are.
So that is dictated by the hospital bylaws.
Okay.
So our hospital bylaws, and you can put it in the bill, say it has to be within a certain time frame. So you can hold people's feet to the fire.
Senator Summers has a question, then we're going to wrap up.
If you don't mind, Dr. Chairman Brass and Chairman Cowser's question is sort of where I'm at too. How will this affect this bill in its present form? tell me the harms, the pros or the cons for rural Georgia, because I'm concerned about rural Georgia, pros and cons for rural Georgia.
So that we to continue providing these services, we do need the mid-levels to operate like we're using them currently. If we restrict the general supervision, we will not be able to provide these services. So these are simple procedures. This is not where I'm going and putting in a stent in an artery, or not me, but this is not where an RA is going and putting it. These are basic, simple procedures. Now, let me give you an example. We're talking about venous access, like it was discussed before, putting in a small catheter in a vein. There's much more invasive stuff that is currently done by mid-levels currently, like in EMT, puts a tube down your throat when in an ambulance and out in the field. They do start some lines. We have to make sure that we standardize the training, but then at the end of the day, we have to make sure that each person is going to be different. And that has to be evaluated by the medical staff of the hospital to allow or disallow that person to do those procedures. And then the medical staff of the hospital is responsible for making sure that quality care is given to their patients. The legislature can make rules. The medical board can define those a little bit better, but it needs to default to the hospital level, to the medical staff, to make sure that the quality review is done, to make sure that there are no complications. If they're having complications, then they take that provider to task. That's what we do. So there is a process that we have to make sure that quality care is given in a timely manner, but there are checks and balances.
This bill in its present form for rural Georgia, yes or no?
With general supervision, yes.
All right. Thank you. Do you have a question? Thanks for being with us. Okay, that's all that we have signed up to speak to the bill. You won't have any final closing comments, Representative?
Just very short. This bill is a bill for a path to the future. For RAs, it's a path to the future for developing techniques. And I would urge this committee to pass the bill as is with Senator Kennedy's amendment that you have in your folder.
Now, doesn't his amendment allow for general supervision rather than either direct or personal? Yeah.
It says performed other non-invasive procedures unless said procedures are expressly restricted by the board not to be performed by radiology assistants.
So they can do non-invasive procedures unless
That's
the
right.
board acts.
That's right.
Chairman.
You good with that?
Yes.
Mr. Chairman,
Summers.
if I may, and I want to help Representative Hawkins, I want to help everybody, but I'd like to make a motion. We table this bill to see if we can get it refined.
Is there a second?
I'll second that, Mr. Chairman. I know that.
Sorry.
Yeah, Mr. Chairman, I know that Chairman Hawkins is putting work into this, but I've got a gentleman from my district that's talking about serious concerns as this would get implemented as it relates to access. And I think some of the questions that the other members have asked reveal an access to care issue in rural Georgia that is not necessarily everywhere else. I had prepared an amendment that quite frankly didn't go as far as we wanted, but thought I thought it might be workable at the time, but after hearing more of the comments and the commentary from Dr. Sheikh, I'm concerned that it does not go far enough. And we're really getting into an area of a true access to care issue, as Chairman Summers was bringing up. And so for that reason, I do think this needs more consideration and more time. So I would second the motion to table.
Before we get to a vote on that, there's another amendment in the file that Ms. Riles prepared or presented to me. You have that. We all have it in our folders. Seems
it
to
was
address the
yesterday.
same
Yeah.
issue with a little bit more precision that you would need a
Right,
patient.
0078. I think you probably still have in your folders.
Is that addressing the same situation just with more specificity?
It is.
So if a
It is.
patient's going to allow an RA to take care of them under general supervision, they would have to have informed consent and it lists the procedures.
It does, and on line 9, it says perform other procedures that may be authorized by the board. So we're looking into the future and some of the things that were addressed today by Dr. Shea. Those procedures may well be in the view of the board performed at general supervision.
Okay. Are you willing to work with Senator Kennedy or other members to try to come up with something here in about 24 hours is how long you got? Because we have another meeting tomorrow afternoon
Okay.
at 4.
Yeah.
And that all depends on the rules calendar. When we get out, it may end up being upon adjournment. Senator Dolzall, you feel free to comment.
Thank you, Chairman.
we
Chairman,
vote.
as you're working through this, I checked with council. I did have concern about the may language on line 109. I just know that, like you, I get tons of calls from people that are fighting the licensure process, not
Right.
necessarily medical, but across the board licensure process.
Right.
He indicated that council did that, that may language there is uncommon, and that we actually want the boards to be in the position of being compelled to issue the licenses. I think to your concern, when I first asked the question, they're probably covered by has not engaged in conduct or activities which would constitute grounds for discipline under this article. And then that last catch-all, which has met other requirements. I think one thing that would, that may be worth looking at is that may language on line 109, if you don't mind as well.
To go to shall.
Yes, sir.
Senator Lucas, you recognize,
Mr. Chairman,
discussing the motion to table.
I'd like to add my 2 cents. I represent, rural Georgia as well as metropolitan Georgia. When I go to Hancock County, who have the worst health outcomes in the state, I think we need to work on this to make sure that rural Georgia is taken care of, because as he said, there are amenities and things in larger cities. Doctors tend to go where their wives want to live. And we are dealing with a serious problem. When COVID hit in Hancock County, they were the #1 in the country with deaths as well as COVID, because we did not have doctors or the necessary folks we needed in rural communities to try to preserve life. And I think that with Senator Kennedy's amendment, I think we need to look at it.
All right. All in favor of the motion to table, raise your hand. Can you help me count page? No, it's not. Anybody opposed? Senator Sims, you voting one way or the other?
I voted yes.
Okay. It is
As long as it's work to perfect the bill.
All right, your bill is tabled. I'm gonna ask you to reach out to the various members of the committee, see if you can come up with anything and get it to me, and we'll see if we can perfect this to take action at tomorrow's meeting, which I didn't know we were gonna have, but now for sure. If we have time, we'll. Thank you. We have to move on. All right, we're going back now to House Bill 449, Representative Rhodes, Chairman Rhodes. You have presented your bill the other day, and we had several people testify in favor of your bill. And I told Mr. Adam Schaefer, who is with Piedmont Water, that we would certainly give him an opportunity to be heard before we took action on your bill. I'm going to let him speak now, and then I'm going to let you discuss any ways to sort of solve the problem. Mr. Schaefer, if you will take the podium there.
Good morning. I'm Adam Schaefer, CEO of Piedmont Water Company. And first of all, I want to thank you for the opportunity to be here today. Specifically, I want to thank Chairman Cowsert and this committee for being champions and steadfast supporters of pro-business policies in this state. Last week, you heard from a couple of disgruntled customers who have spent the better part of the year disparaging our company, spreading lies and misinformation about our business and our family. and misleading anyone who will listen to them, including the author of this bill, which is unfortunately why we are here today. I'm not going to waste the committee's time going through each of those falsehoods, but I am more than happy to provide the facts around their specific issues if the committee has any questions. Unfortunately, we're here today to oppose a bill from House Bill 449. We believe it is unnecessary, overreaching attempt to impose regulation on private water providers. We believe this is a solution in search of a problem, specifically targeting our company at the request of a small group of high consumption irrigation users, some of whom are using upwards of 70,000 gallons of water a month, who are living in multi-million-dollar homes on Reynolds Lake Oconee golf courses. Our customers already have price protections in place through contracts that have been in place for over 30 years and will continue for at least 40 more. Reynolds MetLife, our largest customer and system user, has an established agreement with us, which we believe demonstrates confidence in our pricing and infrastructure investments. Our rate increases for the average household using 5,000 gallons per month have matched CPI or inflation over the past 12 years, except for a one-time increase in 2022 related to a $15 million investment we made in a surface water treatment plant to support the growth we've seen in the area. As encouraged by EPD, we use tiered conservation pricing to manage irrigation demand, which spikes significantly in summer months. Lake Oconee's explosive growth has required significant private capital investment to maintain infrastructure capacity to support this growth and continue to provide safe, clean, reliable service. This legislation would force us to reassess our planned projects, which would negatively impact our customers. This bill would also increase compliance costs and create unnecessary regulatory delays, ultimately driving up costs for both taxpayers and customers. If Georgia wants this level of oversight, it should regulate the entire industry fairly, not single out the only two companies in the state that have invested private capital to develop surface water resources. This bill sets a dangerous precedent. Government should not target specific private businesses due to political pressure from a small vocal group of individuals who are outliers on the system. We urge you all to reject this legislation to protect fair competition, private investment, and continued infrastructure development. Again, thank you for the opportunity to speak, and I'm happy to answer any questions you have about the bill or about our business.
Questions for Mr. Schaefer? Senator again. You're recognized.
Thank you, Mr. Chairman. Said, Mr. Schaefer,
Yes, sir.
help me out. Your private water system, can you provide fire flow to all of the areas that you serve? Do y'all have enough to meet the minimum requirements for the type of structures and the things that you serve?
We have, so we have 71 water systems and 10 sewer systems in 14 different counties. Lake Oconee is our largest area. And so of those, we have two large systems, one in each Greene County and Putnam County. And the customers in those counties are primarily where we have fire protection, and that covers about half of our customers. So in the case of South Greene County, which is Reynolds, which I know y'all are probably familiar with, all of those customers are receiving fire protection.
How do you manage that fire flow? Because for me, I know we dealt with a bill a couple of years ago with a water provider, had 31,000, his name's Mark Smith down in Southeast Georgia. And, his method of covering fire protection was having, their wells are much more productive. They can put in a well that's 1,500 gallons a minute. And for most anything, that'll be a pretty adequate fire flow. In your area of the state, you get a well that's 100 gallons a minute. That's a pretty big well. And obviously not enough to do any significant fire flow. I'm just curious, do y'all put in elevated tanks and the size of the lines in order to meet those flows? And what typically would you do in in a subdivision, say in Reynolds Plantation, what could you flow? Can you flow, 1,000 gallons a minute or more?
So we are, the systems where we have fire protection, which is about half of our customers, we have a total of 9 overhead storage tanks on the various systems. We have 2 overhead storage system, or 3 on the Reynolds system alone. Those total 1.3 million gallons of storage. The fire protection really comes from the ability to generate that pressure, which is from the overhead storage, not necessarily from the source. We're meeting, we're meeting a county minimum standard at least, which for those 2 counties is 500 gallons per minute. And so anytime we design a line expansion, we have a model over the whole systems, and we're always making sure that whatever point can generate that flow in a fire condition. So yeah, and the sizing of the pipes, where the storage is located in relation to the source, all those things fit together.
And so typically when I look at, and Mr. Chairman, if it's okay, I want to continue this question, but for me, typically, and I've run different municipal water systems, those cute little fire plugs, a lot of people look at them as, oh, well, that's a really good thing. Water system operators look at them as that's a leak. Because when you have a fire or there's somebody that needs to go wash their truck out or wash the road off, they're opening up your fire hydrant and draining your system. What do y'all do with those authorized or unauthorized uses of fire system? Do y'all bill the fire department? Do if somebody has a fire, they need to do that? Or some contractors out there decide, hey, I'm going to water my yard, and he opened up your fire plug to do it. What do y'all do? How do y'all manage that type of quote authorized or unauthorized use? What's the fees?
Well, if it's unauthorized, we try to go find them, and usually we get a call. Authorized, we have 30 hydrant meters that it's usually home builders that are getting on to hydrants, and they come check out a meter and then they bring it back and they pay us for whatever use they have. And it's pretty easy to manage. In terms of kind of the bigger picture, typically a municipality, they're managing the fire departments, but they're also managing the utility. In our case, we work closely with the fire departments. They go out unannounced and test our hydrants, and they'll let us know if there's something that's not working, either because there's a faulty hydrant or it's not as modeled, and we get a repair list and we go make those repairs.
If a fire department has a fire and responded to it, and they put 1 million gallons of water on fire, is there a charge for that, or
no?
You provide that water to your customers, basically. Because I imagine you're selling those people water as it is.
That's right. Yeah, I mean, we view it as part of our duty to the community. We're not mandated to put in fire protection, but it really wouldn't make any sense to not be delivering that service.
And just so you know, and I heard a lot of different testimony the other day, but I will tell you, I had actually a old fraternity brother that told me he moved up to Blue Ridge and he was real excited about moving up there. I said, why is that? And, he didn't know anything about me and the history with the water system. And, quite honestly, I was surprised. He said, I'm glad to get off Piedmont Water. And that was where, for me, when somebody comes out of the blue and tells me that, I realize that there is an issue, there is a problem there somewhere. And so, I don't know exactly what we're going to do with this bill, but I do want to make sure you understand. The water business is not all just in little bottles. It's a livelihood and something that's very important for people, and that's why our committee's working on it.
Senator Summers,
Thank
you're
you.
recognized for a question.
Mr. Shaver, if you will, I know you didn't get to speak last week when we were here, but you were called a monopoly. Your business was called a monopoly because you're the only game in town. Is that correct?
That is correct.
So you're the only game in town. Why or what? Can you kind of address why the people were so upset with the charges and the cost and that kind of? Can you address that for us?
I'll do my best.
Okay.
So the water business is, by all accounts, the most capital intensive utility there is in terms of the pipes, plants that have to be built, the sources, filtration, the overhead storage to make all this work and meet instantaneous demand. And in our case, and we're pretty unique, there are other private systems in the state. I'm not aware of any like ours where we have stepped in and filled the void of the municipality. And we started doing that over 30 years ago. I'll get to your answer, but I think it's important to have some context. We started by buying small community systems, and then we used private capital, 25 years ago to get easements from the counties and the state, and put large diameter mains in the rights of way and tied these systems together and put up the towers and started building sewage treatment plants and really kind of filled that void, which is pretty unusual. There's 1,700 private water systems in the state, and there's maybe one or two in the state that have done that. So, we've done all that with private capital. We don't receive any funding from the state. We don't get low interest loans. We pay property taxes. We're in the same industry as the municipal systems, which we're most compared to, but it's a completely different business model in a lot of respects. So, frankly, we have a lot of people moving to the area, particularly in the last 5 years. And we're having to make infrastructure investments to keep up with that. But everybody that comes there brings their history with them from wherever they came from, in terms of what they expect from a water provider. And most times people moving there are moving from a larger city with all, where there's, the water systems are long established. The rates have been kept low. They're often funded with other sources of funds from within the government, including garbage, gas, power, general funds. So we try very hard to keep our rates low. We have contracts in place that keep us, which we try to be very standard across our rate base as much as we can. But we charge more than where most of these people have come from. And I'll be the first to admit, we've always tried to go about our business quietly, and that isn't working very well right now. And we're making, as Representative Rhodes knows, we're making a lot of changes, have over the last couple of years, in informing our customers better as to what they're getting into when they become a customer of Piedmont Water Company. And that's a process, but we're certainly learning from this experience. So I hope I answered your question.
Thank you. One follow-up.
Yeah, almost. I just, Representative Rhodes got hundreds of people, maybe many more than that, complaining about $1,000 water bill of water in the yard or whatever, those type things. And that's an issue. Are you all trying to restructure where you'll have a price for your home water and then a price for your yard water? Is that something you're working on?
Well, we follow our pricing is very similar in structure to most utilities in the state. And we follow the EPD's guidance for tiered pricing to encourage conservation. So, you have a base charge, which many of our customers, I know y'all have some things in your file that kind of show our 85% of our customers are using less than 5,000 gallons or less each month. And that's kind of the standard number for a household of 4 for just in-house use. And then we have tiered by per 1,000 gallons above that. But we have a lot of people who in that 15% that are using, including one of the gentlemen who spoke here last week, that are using 30, 40, 50, 70,000 gallons a month. And that is very challenging from an infrastructure standpoint. And the average water system, you might see the use doubling from winter to summer, and we're seeing 5 times on the rental system. And we got to be able to provide water for the people that are watering their lawn at the same time that people are taking their shower in the morning. There's no.
Thank you.
All right.
Thank you.
Schaefer, thank you for sharing with us. If you will, don't leave yet because
Okay.
we got some wrinkles coming. But if you'll just have a seat.
Okay. Thank you very much.
Chairman,
Appreciate the time.
Rhodes and I have been discussing this situation. And of course, I had conversations with you and your attorneys about some of the added regulations and getting the Public Service Commission involved. And we sit here and you hear us through all these other bills talk about how we're trying to reduce government regulation and rules and red tape. And this bill throws it on there and regulates your company through the Public Service Commission. Will be the first time ever. And I don't think that's the appropriate solution. I had very candid conversations with Chairman Rhodes about other options. Is there another way to skin this cat and give some relief to his constituents in a manner that's fair to your company as well? And he has presented me yesterday with a committee substitute that replaces the original bill. I'm going to have my assistant come bring you and your dad a copy so you can look at it while he discusses. And I'll just briefly tell the committee the concept here would be to not try to impose price controls or rules or regulations on your fee structure, not to interfere with your contract with MetLife, I guess, who was the successor to Reynolds Plantation, but to try to give some options to homeowners. And I'm going to let you describe it to us, what you've come up with, Chairman Rhodes, but essentially it would be to allow private property owners to build their own well if they wanted to, rather than utilize the water service, but at their own expense. Am I close? If you would just walk through this with us, and I've got in my folder, I'm working off of LC 550604S. Is that the one you got? I know you were working on it and might have changed.
Say that again, Mr. Chairman.
LC 55
06.
okay, 0632S. Is that what you got?
That is.
Well, everybody look in your folder and see if you've got one of this. Okay,
That's the latest, that's the latest one that I got.
all right. So we put these around just more. Tell us what this would replace your original bill that passed the House. With a new substitute, you're coming at it from a different angle. Tell us what you want
Yes,
to
sir.
do.
And could legislative council confirm for me that this just pertains to surface water, private water companies that
It does.
distribute surface?
Yes, it does.
That, okay. Yes, sir, Mr. Chairman, basically what this
You can
bill,
see on line 46 where they define surface water. And then they reference it in the bill.
okay. All right, basically, Mr. Chairman, I think what this bill does is it basically, you pretty much described it right there, is it says that if a property owner wants to drill a well on their property, that they can drill a well on their property.
And it would supersede the covenants.
And in this situation, I may or may not understand, are there covenants in these subdivisions that prevent private wells, or is that some local ordinance? There was some potential impediment there.
There are contracts and covenants all around Lake Oconee, both in Greene and Putnam County, from the old original water systems that were deeded to them way back when. Some are 40, 50 years old. But yes, sir, that there are contracts and covenants.
And your proposed committee sub at lines 22 and 23 make it clear that if somebody were to drill a well on their property, they can't go sell that to somebody else and compete against Piedmont Water. And this would be for personal use only, for irrigate your yard or your house or whatever.
That is correct. And per this reading, I don't think they can share it with a neighbor either.
Okay.
It's got to be per parcel, per
So
owner.
this doesn't create competitors for them. It's just some other option if somebody wanted to spend the money to drill a well and hope they hit water under their property.
Yes, sir.
any other portions of this you want to explain to us before we open up for questions?
I think it's pretty, I mean, it's pretty self-explanatory, Mr. Chairman, as you have just stated and then explained through questions back to me. I think that's pretty self-explanatory.
You think this would satisfy the concerns of your constituents that are?
It would definitely give them another option if they so chose.
Okay. Any questions from committee members? Senator Ginn?
Thank you, Mr. Chairman. Yeah, Representative Rhodes said one of the things we passed a few years back was the ability for somebody to drill a well on their own property if they had more than an acre. Said basically, I think if you have a well and a septic tank, then the health department regulations require that. And the way I read this, and when I look over on the very last section, the starting at line 72, I believe that's kind of saying that I'm not sure, maybe legislative council can address it, but that's basically that we're not going to get outside the health department regulations with any of these wells. And I was curious, in your area, how many of these property owners have a well or have a parcel that's less than an acre? If I think about a half acre lot and they want to go put in a well in their own septic system, that's probably not going to be allowed under the health department regulations. So I'm kind of curious what that does. Do you have big parcels, little parcels? I don't know that much about the area that's.
I think you're right on that as far as DPH is concerned, Mr. Chairman, but there are a number of parcels that are under an acre. On golf courses around the lake, there's some that are bigger than that, but the majority of them, in my opinion, probably would be less than an acre.
But I think this would do a lot for those larger parcels. I just kind of curious on the smaller parcels, does that give those landowners an option? And what would you suggest for those that are less than an acre, if they have a well and septic tank, or if they have a septic system?
That's if they
have a septic system and they're less than an acre, because it takes an acre under health department regulations to have a well and septic tank.
Do these homes have septic tanks, or I thought the Piedmont was providing sewer service?
They are. The majority of these homes do not. Now, if somebody built on the lake in 1990, they have a septic system.
Okay, so
But-
that would apply to.
And then the question is because I want to be fair to Piedmont's put a lot of money into building a wastewater treatment and those kind of things. How would this legislation that's proposed make sure that most wastewater systems that are collections are based on the amount of water that you're using? So how would you expect to make sure that compensation is there for the sewage usage from Piedmont?
We would have to come up with a formula, in my opinion, Mr. Chairman. And, I would also like to see a provision in here where sewer service could not be denied also.
Senator Summers, you recognize?
Mr. Chairman, if I may, Representative Rhodes and Senator again, it's been my experience, I've done this before. If you have less than an acre of land that's required by a health department to actually put in a potable well, that's good. But if it's non-drinkable water and it's just using for your irrigation system, they would have to sign a declaration, from what I understand, with that health department to allow them to put that well in. So they use it only for surface watering or yard watering. It would not be for house drinkable water, potable water. And I think that would probably give you the latitude you're looking for.
I think you're correct.
So just.
Mr. Schaefer, would you come back to the podium? It's unfair to not let you comment on this newer version. I think it is intended to address a lot of your concerns with the original bill, but I'm not sure whether or not it creates new concerns, but I want you to be heard before we take action on this.
Yeah, thank you. I appreciate the opportunity to come back up here. It's a lot to consider on the fly.
I get
it's-
that. And
it's-
yeah, we,
You know, it's complex business and, you know, my initial thinking is, yes, there are the concerns that have been brought up about, you know, half acre lots, septic systems versus sewer. You know, I think that both the, at the county level and the EPD would need to weigh in. There's a whole set of concerns there that, you know, are not mine. You know, one of the biggest ones that just pops into my head is, you know, as it relates to wastewater service, there's no way to measure the amount of wastewater somebody purchases without they're using our water in their house. So, you know, is there some way to go through a certification process that this is, you know, only being used for irrigation water? You know, possibly. I'm not aware of that taking place in other places, but that's something we would have to kind of think our way through, I guess.
thanks.
The one point I would make is, you know, we're expected as the utility to provide no matter what. If somebody wants to, I mean, I've made that point just to make it again. And we have to make significant capital investment. Reynolds, the wells went dry because everybody was using it on their yards. And, you know, we started getting iron and manganese and we weren't mandated by the EPD, but we were basically forced to build a very significant capital investment in a water treatment plant in order to supply all those needs. So it's kind of like, well, okay, we've made that investment, met our commitment, and, you know, somebody moves here from Florida and doesn't like it and thinks it should be for free. So it's tough.
Senator Dole is all you recognize for question.
Chairman, I don't know if this is a better question for you, the other chairman or the gentleman, but I'm wondering, because it seems to me that what would solve this problem is if people could drill a well to irrigate their lawns exclusively, still stay on the water system that would have the meter for the sewer count, that would solve your problem, I think, of accuracy of your sewer numbers. And so I'm wondering why on line 20, we identify this as exclusively provides potable water. And I'm not an expert in this. I don't understand the definitions enough. My understanding was potable water is drinking water. Is that correct? So why are we wanting to exclusively provide potable water as opposed to whatever the legal term would be for irrigation water? Or non-potable?
I of course didn't draft this, so I'm not sure. I was intrigued by the concept because, like, you know, in Athens, we're on city water, city sewer, but you do have the ability to drill a well if you wanted to. Most people that do it it's expensive, so not many do, but the ones that do, usually it's for irrigation, or if they had a swimming pool or something like that, you know, that had a large water use, because we do have that tiered system in Athens also and it's for conservation purposes. The more you use, the more they charge it. It's counterintuitive because you would think the cost would be less.
Chairman, I look into this every August when I get my water bill.
Yeah.
The cost of drilling a well, it's never worth it, but I get tempted.
about it.
So I do wonder if maybe the gentleman and Chairman Rose want to comment on just a consideration there to change to non-potable, if that A, solves your constituents' concerns largely, and B, if that solves your concerns as a company.
Number 20.
Line 20 there.
And there's a follow-up after that on line 21, but yeah, we can.
I'd be good with that.
Would you want to change it to non-potable or add potable or non-potable?
I think you need to add it.
Okay. You could perceive that as a friendly amendment.
Yes, sir.
Okay. What's your next question, Senator Dolezal?
That was it. I think if we do both, then it probably gets into his concern relative to if they're bringing water in via a well, but then discharging it through a sewer line for the house. I don't know how he would be able to calculate that. Maybe
EPD approved, EPA.
Senator, again, you're recognized.
Yeah, and I want a question for Representative Rose. The biggest problem is summertime, and I understand from Mr. Schaefer, his demand is summertime demand when they're irrigating their yards. I don't want to, get into a situation where we've got a landowner that has, put in a well, you know, there is usually, there's a double check valve between a landowner's water system and, the community water system. To me, that's one of those things that they're mechanical, they do fail. I'd hate to see, you know, somebody's water system getting contaminated there. Would you be satisfied with just the irrigation water, Representative Rhodes? You know, this takes care of the, you know, large volume of use. It does what my esteemed colleague from Forsyth says, that, hey, it's where, you know, why not just make it the irrigation side of the water instead of, the whole household water? I don't think you've got an issue. It kind of protects the water system and the investment that Piedmont has made, and gives people an option. And I think, to me, that's really a balance of okay, everybody that's there can do this for irrigation purposes. And I think it gets, you know, the larger water uses, they're not paying sewer and water fees because the two are not tied together. I think it would do what you want to do, but I want to hear it from you instead of just my surmise.
Well, I think that would be a decent compromise to some aspect, so I'd be open to it.
Mr. Schaefer, is that something that makes good sense in your business world, that, you know, you still keep all your customers, you've leveled out the peak demand in your system, and hopefully doesn't push anything further in your system to create that massive investment?
I do understand the concept. The one thing I do want to point out, it hadn't been mentioned, we do give our customers the ability to have a separate tap to buy irrigation water without paying the sewer, and many take advantage of that.
And there may be those that still do it that don't want to put in
Yeah.
a well. I'm not saying this is a
Yeah.
cure-all for everybody, but, you know, this leaves the private property rights to the individuals that are living there to go do an irrigation well if they want to. It protects your water system and your investment, protects the customers from, you know, they can water when they want to, the things there. So
again, I'm taking all this in real time, but I mean, the one thing that remains, which frankly, I do have an issue with, is, I mean, this specifically targets two companies that have made significant investment beyond what other companies have done. I mean, it really is just around our company and one other, who are the only two in the history of the state to make an investment in surface water. So I just don't understand why, I mean, if we're going to do a new regulation, why other utilities wouldn't be in this too.
we could make this statewide, but, you know, I think the situation is the only complaints I've had are from, and I have had the chairman of the county commission down there call me, in Putnam County, and he was telling me his water bill was $1,200 in a month, and I'm, you know, I've heard from residents way outside of my district that are complaining, and when, you know, I've had people that have just said that. I think that's where the issue is. So
I'm well aware of Chairman Sharp's
Okay,
issues.
I'm going to have two more questions, and then we have Judiciary Committee starts in 7 minutes. Senator Lucas.
The question I have, and I guess Senator Ginn might have answered. Wouldn't they, if they dug a well, wouldn't they have to replumb their house? Because most of them, the water is running through the faucets and the plumbing and everything, so they're using sprinklers to sprinkle the yard. So are we talking about not only digging a well, but now you got to bring a plumber in to replumb the house because you're tied into a system?
that'd be pretty easy to separate. Said they can separate out the just tying the well just to their irrigation system and separating it from their domestic water in the house.
Well, the reason I'm asking it, if they water in the lawn, the water's coming through the faucets and everything, they got hoses out there with sprinklers on and everything, they would have to replumb the house.
Most of these are going to be either tied to an irrigation system that is existing, or they're going to add yard hydrants to get away from using the water that's coming out of the house. You know, that domestic water and the ones that are exterior of the house, they probably would quit using those and go just to the well water.
You might find out it's a lot cheaper to stay with you before it's all over.
Yeah.
In any case.
Senator Brass. You're
Thank you,
recognized.
Mr. Chairman. My question is for the chairman, Chairman Rhodes. Chairman, if we pass your original version or we pass this new sub and Piedmont Water decides, you know what, this isn't worth our investment, we're out. What happens?
It would have to be a water authority right quick.
Why was there not a water authority to start with?
Our counties dropped the ball about 30 years ago. I described it last time real quickly. Up until about 25 years ago, Greene County was pretty much broke. All the population were in the cities, Greene and Putnam both, in Edenton, Greensboro, White Plains, Siloam, and they all have their own systems. And as the lake population exploded, we had 3 or 4 private people that would come in and put in the infrastructure. The developer would deed it to them, the system to them, to keep that cost off of their back. And they deed the water system to the gentleman coming in and putting pipe in the ground. And over time, Piedmont Water has acquired and bought up every one of them. And, you know, while we're on that, Mr. Chairman, I just want to make one thing clear. This is not about, first off, I just want to say that I'm very pro-business, as I have helped this family do a number of things for their other business ventures in the past. And this is not about a small group of people. We had a study committee meeting in Lake Oconee, had over 350 there. And I had an email chain of over 600 people that could not be there because they were at work that wanted to be there. So this is no small isolated issue. I want to get that out there. I took over for Mickey Channel 11 years ago. Some of y'all may do that. And I just want this to be on the record. The night I got elected, Mickey Channel told me your biggest headache will be Piedmont Water. Okay. There are times that I go through the day and I spend 1 to 2 hours just on Piedmont Water's problem when I'm at home trying to make a living like we all are. This is no small isolated issue. Just wanted to get that out there. So everybody knows that. And we seem to have problems with certain companies in certain areas when they own the whole conglomerate. When a company owns the engineering firm, when they own the installation firm, when they own the water firm, the actual distribution system, we have a problem. Okay. And listen, I know and want and understand Piedmont Water, they're putting private money in there. I want them to make more money than a municipality. Totally. What I want is for my constituents to know and feel that they're being treated fairly and getting a fair price, which when you give money to a builder, $33,000 to a builder, and 13 months later, you're still waiting on your CO because you can't get into the office at Piedmont Water where they won't answer the phone. They won't answer the door. You can't get in there. I get those phone calls every day. We have over 300 homes under construction at Lake Oconee all the time. So I'm getting these calls left and right, up and down every day. In Piedmont Water, they are trying to come up with a system where their customer service is a major problem. Okay, major problem. The way their people, the timeliness and the way that their people respond, and they're trying to fix that. So I just want to make that clear. I am here for my people. My people don't feel like they're getting a fair price. That's why I came out with my original language. If the PSC says it's fair, it's fair. That's all I want. I want them to get a fair price, and I want that to be justified that they're getting a fair price, because in private water companies, there is not one soul breathing that they have to answer to. Okay, so I want to make that clear. That is why I'm here and what I'm doing. Thank you.
What's the pleasure of the committee? Got a motion to pass, and there's a second. Now, we're going to discuss an amendment. Let me suggest,
What are you passing?
What do you pay?
55463
got it.
Then I'll get an amendment.
Okay. Before you do, Mr. Chairman, let me ask you, would you be receptive to an amendment? We're going to have to let the legislative council put the little legal language to it that changed it to non-potable water in the wells. So it will be used for irrigation and Senator Ginn may have better language and to have the provision you asked for to make sure you can't cut somebody's sewer service off if they elect to build a well.
Yes, sir.
Okay. Well, I'm gonna propose that amendment then. Is there a second? All right, second. Senator Ginn, does that address your concerns or do you have an additional amendment?
Yeah. I think I would put, in the amendment, instead of non-potable water, I put irrigation year about.
For irrigation? All right, I'll do that. That's fair. I didn't know the language. I'll change it.
Because it very well could be, you know, you fill the water's tested, you don't know whether it's potable or not.
Understood. Any discussion on that, Senator Lucas?
What about who determines whether they can put a well on the property? Is it the health department or?
DPA.
I'm just asking.
This-
'cause it's like,
Bill,
it-
If it's
Does
not
not
obligation,
require
it won't matter.
Bill doesn't specify, but other provisions of law might.
Plus it's just irrigation.
Other questions, Senator? All in favor of the amendment, raise your hand. Any opposed? Any further amendments? All right, so we have before us motion do pass LC 550632S as amended. So it'll be a committee substitute. All in favor, raise your hand. And all opposed. We have one opposed, Senator Gooch. Your bill passes committee. It's got some other hurdles to go. I feel like some of this is kind of last minute. I know you were scrambling all weekend trying to find a solution that might work. We may wake up in the morning and find out that this is maybe not quite so brilliant as it seems. If you see some things that you recognize to be problems, and Mr. Schaefer's going to point them out to you and me as well. We have the possibility of amending this on the floor to change it, to perfect it further. The Senate's a little more liberal than the House in that regard, so please keep the communications open. Do you have a Senate sponsor to carry your bill in the Senate?
Senator Anderson had,
Lee Anderson?
yes.
Okay, we'll make a note of that.
Well, I'll be cheering on it. Yes.
With that, I had wanted to have a little
Thank you,
update
Mr.
on,
Chairman.
we had a toxicologist was going to speak on some of the impacts of THC on the human body at different levels, and we're out of time, so we will not be able to hear today or from Mr. Scribbles. We're adjourned. Thank you. We are set for tomorrow afternoon if schedules permit.